Welcome, and thank you for joining us for today's webinar to quickly empower you with up-to-date clinical information and assist you with result interpretation. This is a brief educational webinar examining the interpretation of amphetamine results from Aegis Sciences Corporation. We will discuss unexpected negative and unexpected positive amphetamine results and their potential causes. Takeaways will include understanding the period of detection of amphetamines, scenarios that may explain unexpected results, correction of common misconceptions regarding definitive amphetamine testing, and where to seek out additional clinical support. This webinar is being presented live by a member of the Aegis clinical team, Dr. Savannah Clary. Those who missed the live presentation or would like to hear it again may find a recording of this presentation on the Aegis website at www.aegislabs.com. Please call 1-800-533-7052 if you need assistance accessing the recording.
Good morning, everyone. Thank you so much for joining us. Let's jump right in. The question on many providers' minds when interpreting drug testing results is, what did my patient actually take? In some form or fashion, this question is one of the most frequently asked of myself and my colleagues. Interpretation differs according to whether the test is presumptive or definitive, and we will primarily focus on definitive test results interpretation today. Positive Aegis amphetamine results undergo definitive testing by liquid chromatography and tandem mass spectrometry prior to reporting. For providers who have prescribed amphetamines or who are aware of the patient being prescribed these medications by other providers, a positive amphetamine result is expected. But what about unexpected positive results or unexpected negative results? We're going to discuss a few patient cases and see how the result interpretation may go based on consultation with the Aegis clinical team. Our first case involves patient AB. AB is a 27-year-old male returning to the clinic for a follow-up appointment after a recent urine drug test. The patient is prescribed buprenorphine and naloxone sublingual films and has been doing very well. The provider is very surprised to receive definitive test results from Aegis indicating amphetamine use. Before going in to see the patient, the provider calls the Aegis clinical team for assistance with result interpretation. AB's results are pictured on the screen. I have heard from providers with similar patient cases on many occasions, and I remind them of the many pharmaceutical amphetamine products that may cause this result. Is the patient seeing another prescriber, or what information is available on the prescription drug monitoring database? Some providers are concerned about possible methamphetamine use, since amphetamine is also a metabolite of methamphetamine. However, in the case of methamphetamine exposure, methamphetamine is typically also present. At this point, the provider will likely have additional questions for the patient about recent exposure to the agents listed on the screen or generic equivalents of these products. I would also remind the provider that the period of detection for amphetamines in urine is up to 5 days. This will help both the provider and the patient as they think back and try to determine the cause of the positive result. Now let's turn our attention to TW. Patient TW is a 19-year-old female presenting to her primary care physician for a new prescription for Vyvanse. It's just after the new year, and the patient is preparing to return to university for the spring semester. The patient has a consistent history of compliant drug testing results, so the provider is concerned to receive definitive test results from Aegis indicating the patient is non-compliant with her medications. Before going in to see the patient, the provider calls the Aegis clinical team for assistance with result interpretation. TW's results are pictured on the screen. Unexpected negative results are naturally concerning to providers because of the risk for drug diversion. Providers are often looking for clinical explanations that will support the unexpected results before confronting the patient regarding noncompliance. Providers don't always share this much information about the patient case when they call in to Aegis, but I might ask if the patient had missed any doses of medication recently, or perhaps taken a break from the medication. At this point, the provider may share with me that the patient has been home for winter break and is returning to university. I would encourage the provider to ask the patient when she took her last dose of Vyvanse. Many patients taking amphetamines for attention or hyperactivity disorders take a break from their medication on weekends, holidays, or other times when their symptoms are not as disruptive. There are additional factors that may contribute to unexpected negative results that are not necessarily relevant to this case but may affect other patient situations. If the urine is dilute or less concentrated, this may have cause amphetamine levels which are not detectable above our reporting threshold. Also, recent vomiting or diarrhea may affect GI absorption and subsequent metabolic steps, causing unexpected negative results. Aegis provides special report comments to alert providers when urine creatinine falls below 20 milligrams per deciliter. Urine samples with such a low creatinine level are less concentrated, and urine drug concentrations may fall below the reporting threshold in such samples. Patients who drink a lot of water, consume caffeine, take diuretic medications, have disorders of antidiuretic hormone or other physiologic disturbances affecting urinary concentration may produce less concentrated urine. Intentional dilution may occur either with intentional ingestion of copious amounts of water or by adding water to the urine sample from the restroom sink or toilet. Such aberrant behavior should be considered in the context of the entire patient presentation, with a provider using his or her clinical judgment to assess this possibility. Coloring the toilet water blue prior to sample collection and assessing the urine temperature within 4 minutes of collection, which should be between 90 and 100 degrees Fahrenheit, are additional measures to check for sample tampering. Sometimes the issue is not patient compliance. It may have to do with how the testing is ordered. Let's find out why with the case of KS. Patient KS is a 12-year-old female brought in by her mother for a follow-up appointment after a recent urine drug test ordered by her pediatrician. The provider is surprised to receive definitive test results from Aegis indicating noncompliance with amphetamines. The patient's mother refills KS's Concerta on time each month, and her pill counts have always been correct. Before going in to see the patient, the provider calls the Aegis clinical team for assistance with result interpretation. The results for KS are pictured on the screen. A common misconception is that methylphenidate products are also included in Aegis amphetamine testing. Methylphenidate is structurally distinct from amphetamine and undergoes a separate testing process at Aegis. Providers wishing to assess compliance of methylphenidate medications may consider adding this test, which is currently only available in urine. Examples of methylphenidate medications are listed on your screen. After consulting with the Aegis clinical team, the provider realized she had not ordered medication compliance testing for the prescribed drug, and she requested to add on methylphenidate testing for the patient sample. The Aegis Client Services Department faxed over an add-on test request form, and the sample was set up for methylphenidate testing. The patient's sample was positive for methylphenidate, as shown on the screen. Switching gears from patient cases, let's talk about some of the things that prompt providers to call our clinical team. A very common question is about the potential for false positive results caused by other medications. Some point-of-care testing devices may result in false positives for amphetamines in patients who are taking certain prescription, over-the-counter, or illicit medications. Cross-reactivity can occur with this type of testing among drugs with similar chemical structures. Non-amphetamine prescription or illicit or over-the-counter drugs would not cause a false positive for amphetamine on Aegis definitive testing. Please see below for a list of drugs which may cause a false positive for amphetamines on point-of-care testing. Because some of these are over-the-counter, the interpretation may not easily be obtained from the patient's medical record. Please refer to the package insert that came with the point-of-care testing device being used, or contact the manufacturer for more information regarding which drugs can cause false positive results. This information may differ among devices and manufacturers. Another question we hear is about pre-workout drinks and energy drinks and supplements. Patients may claim that these things cause them to test positive for amphetamines. Amphetamines are controlled substances and would not be expected to be found in over-the-counter supplements. While supplements are not developed or regulated with the same level of oversight as FDA-approved drugs, The presence of controlled substances such as amphetamines and over-the-counter supplements is not likely. Before we wrap up, I want to tell you how to get in touch with us for additional clinical support. The individuals pictured on your screen are my colleagues, the clinical pharmacists of Aegis Sciences Corporation. We are ready and willing to take your calls and emails regarding today's content or any other questions you may have about result interpretation or drug testing in general. The information covered today is also available in a written form, accessible online at www.aegislabs.com. If you go to the Resources tab and then click on Clinical Update, you'll find a written and downloadable form of this information. You're also welcome to send questions in to our clinical line at 1-877-552-3232 or send an email to clinical@aegislabs.com. We'll be happy to respond to your patient questions, to your individual report questions or general questions you may have. So thank you for tuning in today. I hope this has given you additional insight into what did my patient actually take. Next month, we'll have a similar webinar on methamphetamine result interpretation. We know that's a common question we receive from many of our clients, so we look forward to providing that information to you next month in a similar format. So thank you again for joining us today, and please let us know if you have any questions.